You're watching ABC4 News.
A new Intermountain Healthcare study finds that blood type does not affect COVID susceptibility or severity of illness. ABC4's medical correspondent Saray Chen has more on this in today's sponsored segment.
Well, new research is just coming out on the subject of blood type and any connection, if any, of COVID-19. We have Dr. Jeffrey Anderson, a cardiologist at Intermountain Healthcare Heart Institute. Hi, Dr. Anderson. Thank you so much for joining us.
I'm happy to be with you.
Well, you led the research on this. This is big news. Tell us about it, because we've heard, oh, if I have a certain blood type, maybe it gives me more protection against COVID-19.
Well, thank you. That's true. We read articles coming out of China early in the pandemic and then later out of Italy and Spain that suggested that type O would be protective and type A might make it more likely that you would either get the infection or that it would be more severe. But then there were other studies that came out, for example, from New York and Boston, that didn't find a connection. And most of these were fairly small studies. So we set up a database at Intermountain Healthcare for COVID-19 early in the pandemic. And we thought, well, let's look in this database to see if we can replicate that. So between March and November, we found 1,000 cases of subjects who had been tested for COVID and also had a blood type in their medical records. And we looked to see if there was a higher risk for any of the blood types, particularly A maybe, and a lower risk for O, for getting the infection if they were tested, and then having to be hospitalized, secondly, and if you were in the hospital going to intensive care. And the interesting, maybe surprising finding was that we did not find a connection between any of the blood types and whether you got infected, whether you then had to be hospitalized, and then whether you had to go in intensive care. So at least in our geography, among our population, it was mostly ancestry in Northern Europe, we don't think that that's one of the risk factors that we should worry about. We should be more worried if we're men, if we're older, and unfortunately, the minority populations had a higher risk as well. So we confirmed that these well-established risk factors indeed hold true in Intermountain, but not blood type apparently here.
Well, that may give more peace of mind to some folks, and we shouldn't, or anxiety in others. We should not really focus on blood type is really the takeaway, Dr. Anderson.
That is, I think that these other studies may apply in different populations, or they might have been due to the play of chance, because each study was a little different. And so there wasn't a consistent finding for blood type. And it might be associated in those other populations with some other factors that actually were more causal. At least that's our takeaway message.
And I think also the takeaway message is still at Intermountain Healthcare and across your healthcare system, we're still masking up and we're still taking the precautions.
We are. We see the light at the end of the tunnel, but we're not there yet. So we need to be careful.
And again,
get vaccinated.
That's right. Get vaccinated. And again, this research is published in JAMA, correct?
Yes, it's published this past week in JAMA Network Open.
All right. Thank you so much. And of course, for more information about the subject, you can always go to intermountainhealthcare.org. Thank you, Dr. Anderson.
Thank you.